We've been talking about external tibial torsion and how it's an underlooked at issue for any kind of pain or issue basically from the low back down. So we've discussed what it is, how to test for it, some of our recommendations on if it's causing issues at the foot, the knee, the hip, the low back. Today we're going to give you kind of a case report. So one of the things, one of the patients we've had in the past has had external tibial torsion. If I remember correctly, it was on both sides of the leg. Like I said, it can be on one side, it can be on both sides. If it's on both sides, it can be equal. If it's on both sides, it can also be, one can be more rotated than the other. This person's case, that she had it on both sides. One leg was a little bit more rotated than the other. Also had a few other structural slight abnormalities that's kind of normal going on, but also loved to run a lot. Was in very good shape, but as they were running, and unfortunately as we get older, we know our recovery stinks and different things happen. We're starting to get some injuries, we start to get some lingering aches and pains and things. So we had to really work on this person with changing up a little bit of their gait mechanics, how they're actually running. We actually worked on changing up their strike. They ran on their forefoot, which means they basically, when they were running, they landed on their toes. Not necessarily a bad thing, but when you've got this external tibial torsion, and just a forefoot strike in general is more prone to causing issues because it actually helps. The forefoot strike breaks down the muscles in the calves much faster than a normal midfoot or rear foot strike, or landing on the back of your foot or the middle of your foot. So we had a bunch of calf issues. So we really worked on mechanics and the strength of the foot, some mobility and things through the calf and the foot as well. And actually changed up the running gait just a hair and been able to actually run pretty well, mostly pain-free. But had some aches and pains there, but wasn't having any like days, wasn't laying her out for days and days and days. So this is how these recommendations and how a good assessment and good rehab plan can really keep someone running, keep someone doing their activities, keep someone strength training, keeping people active. And it's, like I said, external tibial torsion is one of the very first things we look for when people are complaining about pain with their activities, anywhere from basically the low back down. If you're a practitioner, that's a great thing to start checking out. If you're not a practitioner, if you're a layperson, or if you're just a general person from day to day, it's a good thing to kind of check out for yourself as well, just to see if maybe you've got it. And I want to give a shout out again to one of our friends and mentors, Tom Mashad. Check out his website, humanlocomotion.org. The injury-free running book was written for anybody to understand it. It's got exercises, recommendations, and a bunch of information in here. So if you're having some issues, you want to learn a little bit more about this yourself, feel free to check this out. Thank you, Tom. Everybody have a great day.